Hi Tani, you are on mute.
Thank you, Rahul.
Okay.
Good afternoon, everyone, and welcome to our session. I am Dr. Tarini Puri from Voice of Healthcare, and I welcome you all to this series of discussions titled Empowering Oncology Through Nutrition that VOH and Esperer have planned for National Cancer Awareness Month. This series focuses on risk reduction and cancer prevention by trying to bridge the gap between conventional oncology approaches and the realm of nutrition. Today, we have with us an expert in the field of oncology, Dr. Joydeep Ghosh, who is a senior consultant medical oncology at Apollo Hospitals and has over 16 years of experience. He is also an internationally recognized leader who has led global large scale clinical trials for several cancer types. Good afternoon and welcome to our session, Dr. Ghosh.
Thank you, Dr. Tarini.
It's a pleasure to have you today. So, in this session, we will be focusing on the role of nutrition in colorectal cancer prevention and treatment. And now, to
Right.
begin our session, I would like to request Dr. Ghosh to give a brief introduction on colorectal cancer.
Yeah.
Um, um, Dr. Ghosh, would it be, sorry to interrupt you, would it be possible for you to, we can't hear you, could you wear earplugs or could you rejoin? There is some issue with the audio.
Can you hear me now?
Yes, Dr. Ghosh, welcome back.
Oh, yeah.
I think there was
So
some
as I was,
technical. Yes, yes.
yeah,
Could
yeah,
we start again with the
okay,
introduction? Thank you.
yeah. So colorectal cancer is one of the cancer which has been, taking lives for a very long time. And
Mhm.
initially, we used to think that it is a disease of the developed nations. It is the disease of the riches. but it is not the case. It also affects people from lower socioeconomic strata. It also affects a large chunk of people from the developing nations like our country. And on an average, there is a 1 in 25% chance in a lifetime that one can have colorectal cancer. And if you look at the incidence, roughly around 35 to 40 individuals out of 1 lakh population has a chance of developing colorectal cancer. The most common age group to develop colon cancer is usually 55 to 65. Most of the countries, the median age is around 60. And obviously, there are multiple risk factors, etc.
Could you also add a note on the signs and symptoms that one could look for? So, for early detection and so on?
Right. So colorectal cancer can be divided into two groups. One is colon cancer, one is rectal cancer. Both are, although they share the same organ of origin, but they are different as far as clinical presentation is concerned, as far as treatment is concerned. Colon cancer patients can have constipation, can have abdominal pain. Some patients can have undiagnosed anemia. Like, for example, somebody who is an elderly male is having persistent low hemoglobin without any obvious cause of blood loss. That can be one of the initial presentations of colon cancer, because when these tumors are small, they tend to keep on bleeding into the gut, and that bleeding might not be very overt sometimes. So these are the features of colon cancer. Now, talking of rectal cancer, since it is situated more towards the anus, so obviously the common symptoms are pain, blood, streaked stool. These two are the most common symptoms of rectal cancer, and obviously constipation. But most important, I want to add here is that anybody who is having a recent change in their bowel habits, that should be taken into account and should be investigated whether it is from colon cancer or not.
Okay. Thank you, Dr. Ghosh. Could you also add a note on causes and risk factors, mainly focusing on what are the modifiable and non modifiable risk factors?
Right. So colon cancer has got a large number of risk factors. The most common one is age. Obviously, that is not modifiable. There are some races which are more prone. For example, in US or other parts of the country, black races have a higher incidence of colon cancer. If somebody has certain diseases of the colon, like inflammatory bowel disease, one must have heard of ulcerative colitis or Crohn's disease. These are the diseases which predispose a person to colon cancer. Also, somebody who has a habit of low fiber and high fat diet, they have higher chance. Somebody taking a lot of red meat, obviously alcohol and tobacco both are directly related with development, and only a very small percentage of patients have something called a genetic cause. There is a misconception amongst most patients that many of them think that majority of the colon cancers are genetic. On the contrary, it is a minority of colon cancers which are genetic. Majority of the colon cancers, I would say 95% of colon cancers, are not genetic, and they have variable risk factors. Now, coming to the modifiable risk factors, well, obesity, food intake are the most important modifiable risk factors. Increase in the physical activity, avoidance of alcohol, tobacco, and also treatment of inflammatory bowel disease. These are the factors which can be modified. But that if some families have certain genes which predispose them to colon cancer, in those situations, screening is very useful, because it picks up colon cancer development at an early stage where optimum treatment and cure is possible.
Okay. So building on the modifiable risk factors, you mentioned obesity, you mentioned nutrition. So is there so could you mention some specific role of nutrition in colorectal cancer prevention?
Right. So if we talk of obesity, definitely fat-rich food, very high carbohydrate in diet, or excessive eating, these needs to be avoided. These needs to come down. Also, apart from nutrition, we need to take care of the physical activity and reduce the weight as much as possible. Coming to specific nutritional interventions which would reduce the chances is that people should have a high fiber diet, and they should have higher or normal, at least normal levels of vitamin D in their diet. And patients or people who have vitamin D deficiency, they should be treated because low levels of vitamin D in blood is a strong risk factor for development of colon cancer. Also, when you're talking of food, type of food, people who take a lot of beans and legumes, they do better compared to those who do not take them. And in food, we need to avoid unprocessed fruits and vegetables. We need to definitely avoid red meat as much as possible, and of course, avoidance of alcohol intake.
Okay, thank you, Dr. Ghosh. But could you also talk about some nutritional requirements for suppose patients who are already suffering from colorectal cancer, or in your experience, if you have come across an experience or such patients who really look after their diet and how their prognosis and so on is?
Yeah, so if you look at whatever clinical research has been done on nutrition during the treatment of any cancer, not just colorectal cancer, you will see that majority of the studies have concluded that optimal nutrition is very important to achieve the maximal benefit of treatment. And there have been studies and clinical trials which have shown that people who do not achieve that optimum level of nutrition, their survival chances are lower compared to those who have optimum levels of nutrition. Now, during treatment of colon cancer treatment largely involves surgery of the tumor followed by plus or minus chemotherapy for early stages, and for advanced cancers, it is primarily chemotherapy with a combination of targeted therapy. So during chemotherapy, many patients have problems of ulcers in the mouth. They have problems of diarrhea or constipation, low appetite, excessive abdominal fullness. So to take care of these, what is important is you need to have an optimal diet, rich in proteins, rich in vegetables, and of course, a small meals taken multiple times that improves the food intake, and of course the optimum calorie requirement, optimum protein requirement, and optimum micronutrient requirement. These are very important because we need to maintain that optimum protein level or albumin level in the blood, and also take care of the micronutrient requirements that normal people have, so that the drugs which we give for these cancers, they work better.
So, as you mentioned, like previously in our previous discussion, that vitamin D was a vitamin that was really missing, or if that the deficiency of that vitamin could cause or lead to the cancer. So, in your experience, what have you seen in your practice that your patients, what kind of nutritional deficiencies do they have in urban livelihood and in a rural livelihood, and what would you recommend them if you had to, like, as a piece of advice for prevention or even further treatment for different
So
segments,
what I
basically?
have, yeah. So in my experience, what I have noticed is that there are a couple of things that needs to be mentioned because there are certain myths about nutrition in cancer. So the first myth that I want to bust is people stop taking sugar because they feel that if you take sugar, the cancer cells will increase. Well, I need to mention here that your cancer cells are not dependent on your sugar intake to grow. If they are growing, they will anyways grow, they will extract sugar from your blood. So you cannot actually starve them by stopping sugar. So I'm not saying that excessive sugar intake is good because it has got some ill effects. But at the same time, whatever normal sugar intake is required to have a normal diet, normal composite diet, that amount of sugar you can take, there is no problem in that. Secondly, another common myth that I have seen amongst patients is that whenever they are diagnosed with cancer, they suddenly stop taking normal diet and switch to a very restrictive diet. This is very dangerous for treatment because when you are restricting your diet, you are reducing your calorie intake, you are reducing your protein intake, as well as micronutrient intake, which is very harmful because our treatment will not work if the body does not have adequate nutrients. So try to maintain a normal diet. Do not switch to a very restrictive diet given in some internet or anything like that. Try to have more food supplements. If you are unable to have a normal diet, you should take more of protein supplements which are available after consultation with the dietitian. Every colon cancer patient, or rather any cancer patient, should have an appointment with the dietitian or the clinical nutritionist to ascertain the nutritional needs of a particular patient and then address the deficiencies that are there. Another thing that I want to highlight is patients who are from the urban population, since a large chunk of them are working class and they mostly spend their time indoors. A significant chunk of them have vitamin D deficiency, which is not good for colorectal cancers, rather, which is not good for anything. So, but that is not a problem for people coming from the rural population because probably they have a higher exposure to the sun. So you need to check the vitamin D levels at regular intervals, and if it is low, then you should take oral supplementation. If it is very low, you should take injectable supplementation so that they normalize.
Thank you, Dr. Ghosh. That was really insightful. Thank you for demystifying the myths surrounding this issue. I would
Right.
now like to, would you like to add another note or would you like to send another message to our audience?
Yeah. So a couple of messages actually. First is, mm, do not think that the absence of a risk factor makes you immune to development of cancer. That is not the case. Any cancer which develops is usually a combination of risk factors and certain abnormal mutations that can happen, which is normally happening in our body all the time, and sometimes a deleterious mutation can lead to development of cancer in addition to the risk factors. So it is not that if you stop taking alcohol, if you stop smoking, if you stop your fatty food, you are immune to development of colon cancer. That is not the case, but definitely if you can do these things, then your chances of developing colon cancer reduces. Secondly, uh, you should get involved in screening of cancers. Colon cancer also is one of the cancers which has got a screening program in place. After the age of 50, you can go for an occult blood test in the stool every 2 to 3 yearly. And for high risk individuals, you can go for colonoscopy even at an earlier stage. So that helps us detect cancer at an early stage where it is still curable. Thirdly, if you have developed colon cancer, you should primarily focus on how to get it treated rather than feeling guilty. I have not done this or I have not done that. That's why I have developed colon cancer. It doesn't help. But you should have a positive mind and go ahead in discussion with your doctor. You should go ahead and feel positive about the treatment. Try to maintain a nutritious diet, which is rich in vegetables, fruits, micronutrients. Avoid alcohol, avoid red meat, avoid fatty food, increase the intake of protein in your diet so that the best chemotherapy results can be achieved. And fourthly, or lastly, if we can complete the planned treatment with all possible efforts from the doctor as well as from your side, a large chunk of colon cancer is actually curable. So that is one good news for all of you.
Thank you, Dr. Ghosh. That was really informative. And I believe our audience would have felt the same too. I would really like to thank you for your time, for the effort, and for helping us understand the role of nutrition and the different what kinds of food we should avoid and what we should eat, about screening and everything. It was really helpful. And now, with this, I would like to conclude our session for the day. I'd like to thank our viewers for their time, and I would request everyone to stay tuned for our next session on this series. Thank you, everyone, and have a good day.
Thank you.
Thank you.